Well, we're back with Dr. Chiu. Dr. Chiu, many times patients have a missing tooth, maybe 2 or 3 or 4 missing teeth, and maybe sometimes those teeth are missing for a long time, years. And nothing really bad is happening. Apparently nothing bad is happening, at least. So tell us, why is it that dentists like you keep saying we need to replace those teeth and it's very, very important, when, as I just said, apparently it isn't all that bad. Usually those missing teeth are in the back, of course, because in the front people would run to a dentist and fix it right away. It looks ugly. But in the back, so shed some light on of what's going on there with those missing teeth and the importance of it, when yet we, the patients, really don't see much of a difference, as they're missing.
Sure. What happens is when once you're missing a tooth, teeth will start moving into different places, and they usually like to move to the space where the tooth is missing. And with time, that causes a chain reaction. Your bite will change, which teeth, once it's out of place, will cause some. It will be more prone to getting cavities because the tooth is harder to clean, and also gum problems. Your occlusion, that means your bite will also change with time. So restoring teeth that are missing is very crucial. The earlier possible, the better it is to prevent this problem.
So when you say the bite is changing, what do you mean by that? Are you meaning teeth are shifting, or what's going on there?
Well, as you know, the teeth comes together from the top teeth and the bottom teeth. They come together like a key. So if teeth are missing and they start moving around, it's like the way your teeth come together changes, and that changes your bite, which could eventually cause some problem on the joint of the jaw, and that's something that if it's not corrected, it can cause some problem with what we call a joint problem, TMJ.
Okay, so basically the joints, because you have teeth missing, so your teeth are shifting. That's what you mean by changing the bite? You're saying changing the bite, but what does changing the bite really mean? Does that mean the teeth in there start getting crooked and they start getting, like a fence, which is where the balls are falling off and the hinges are used uneven, and they start like a door hinge, they start kind of not matching correctly? Is that what you're talking about?
Yes, exactly. It needs to be balanced. Your jaw needs to have it needs to be balanced, and when something changes, and it can cause a little imbalance on the jaw, which eventually leads to some other problems, which could be TMJ. Like I said, it's a joint problem. So. Yeah, it's important.
That joint problem in itself, what does it do? Does it pull your muscles? Does it make your face look ugly? I've heard that apparently because of it, you could possibly, when maybe you get neck and muscle tension and even headache. Is that the stuff you're talking about when you say TMJ problems?
Yes, that's correct. You can experience sometimes headaches, sometimes jaw soreness, and different symptoms related to ache or soreness around the head area.
Right. And it doesn't come all that fast necessarily, because that's why we don't see those problems, but they're building up slowly. Is that what it is? I mean, we have a tooth missing or several teeth missing for a few years. It doesn't necessarily wear out the chart, and all that, the hinges. It doesn't wear out right away. Is that what you're saying? And so it slowly builds up, and then maybe we're sleeping and we're thinking we have a bad pillow because we have back tension, when it's really the face because of the teeth is missing. Is that what you're saying?
Yes. Well, the process, once the tooth is missing, is actually teeth start shifting very slowly. It's not a very fast process. But what happens with time, you will notice little changes here and there where the symptoms you will experiencing headaches here and there, or maybe some jaw soreness, possibly because the fact that your bite or your occlusion, what we call the occlusion, is changing in your mouth due to the lack of teeth. So that's one of the possibilities from not restoring the missing teeth. Yes.
So basically, are you saying that if a person out there is experiencing, let's say, headaches and neck and shoulder pain, tensions here and there, and he has gone to a chiropractor, he has tried to go fix it with a doctor, but it doesn't quite away, and let's say he has missing teeth, maybe he doesn't, because I think probably a jaw can be out of alignment even if the teeth are all in it, but let's assume he has missing teeth. Would it be wise for him to go to a dentist like you and say, look, I checked this, I checked that, but I'm still having headaches, I'm still having, sore muscle pains in the neck, in the shoulder, and to check, as you call it, the bite, and make sure that everything is correct, and maybe by doing so can fix it, or at least eliminate it of saying that's not the cause? Would it be wise for a person to do that?
Yes, and the pain, it varies, but it will not go as far as down to the shoulder, most likely. But it's usually related to around the jaw area, maybe the part of the head area in the back of the head, but nothing down to the shoulder. But definitely, yes, we take a lot of different symptoms. We look at the different factors in the mouth to evaluate if that's the cause of it. But more likely, having missing teeth can lead to that problem. But having missing teeth, not restoring those missing teeth, can also lead to other more direct problems, such as having teeth not being aligned causes the patient to have problem cleaning their teeth, and not cleaning their teeth properly leads to cavities and gum disease.
Okay. All right. So basically, it's a chain reaction with many little things, but very obviously, having like maybe little headaches, tensions in that area in itself makes the day very, very uncomfortable, and makes the nights uncomfortable, and robs the person of sleep and all kinds of stuff, and probably makes the person maybe even looking a little ugly. I mean, imagine hinges being out of alignment. I mean, there must be some, facial destruction there. That's why orthodontists, need to make sure that the teeth are arranged perfectly, right?
That's correct, yes.
Okay. Well, Dr. Chiu, thank you very much. Thanks for your candid information. I'm sure that people out there will hopefully learn something, and, it looks like we should all get our teeth fixed, even though currently it looks like no big deal happening, because once those things are happening, which you mentioned, they, I'm sure, are much more difficult to repair, and who wants to run around with even just slight headaches and tension in the neck area? Thank you very much, Dr. Chiu.
Thank you for having me. Thank you.